Hi, my name is Alice Aviles. I'm going to talk about the fecal microbiota transplantation from primary Clostridium difficile infection. First of all, I'm going to talk about the definition. The microbiota is the set of microorganisms, bacteria, fungi, archaea, viruses, and parasites that they reside in our body, which in turn can differentiate into diners, mutualists, and pathogens. They are found in different parts of the body, such as on the surface or deep layers of the skin, microbiota of the skin, in the mouth, oral microbiota, the vagina, vaginal microbiota, and the gut, intestinal microbiota, are called normal flora or commensals. Fecal microbiota transplantation, TMF, consists of obtaining microorganisms of the stool of a healthy individual donor to enter the gastrointestinal tract of a person with recurrent C. difficile receptor infection with the goal of restoring damaged intestinal microbiota. To perform the TMF can be used three ways: via nasoduodenal tube, via colonoscopy, or through cleaning.
Clostridium difficile with fecal microbial transplantation. A healthy digestive system is home to thousands of bacteria. The intestinal tract includes the stomach, small intestine, and large intestine, which is also known as the colon. In most cases, these microbes are harmless or even beneficial to a healthy individual. However, conditions that require treatment with antibiotics can kill off many of the good bacteria in the colon, allowing the bad bacteria, called Clostridium difficile, to take over. Toxins released by Clostridium difficile can damage the lining of the colon, a condition known as Clostridium difficile colitis. Clostridium difficile infection can lead to life-threatening complications, such as toxic megacolon, where the colon becomes dangerously enlarged. Clostridium difficile is normally treated with a course of antibiotics, but recurrent infection occurs in between 20% to 60% of patients after an initial episode. The standard treatment for a recurrent infection is antibiotics, but in cases where this fails, there is a new alternative treatment. An emerging solution for patients with recurrent infection is fecal microbial transplantation, or FMT. Also known as stool transplantation, FMT restores good bacteria in the colon by using the good bacteria from a donor. Stool samples are obtained from healthy donors and are screened to ensure there are no infectious diseases. There are different ways to introduce the good bacteria, but one common way is with a colonoscopy. First, the stool is prepared by blending it with normal saline, which is a saltwater solution. Using a colonoscope, this mixture can be applied to the entire length of the colon. Studies have shown that over 90% of patients treated with fecal microbial transplantation are cured with no significant side effects reported to date. Please speak to your doctor about fecal microbial transplantation if you are considering this treatment.
Okay. The pros and cons. The TMF is a safe procedure, at least in the short-medium term, cheap, and that has been shown to modify the microbiota of the diseased recipient and resemble that of the healthy donor. The most common symptoms in the first days are feeling of bloating, abdominal pain, diarrhea, flatulence, and nausea. Other side effects are vomiting, constipation, fever, pruritus, headache, cold symptoms, and elevated C-reactive protein.
Clostridium difficile is a type of bacteria that can cause severe infections in the gut. As many as 1 in 30 of us have C. difficile present in our digestive system. In those with a healthy gut, it can live harmlessly because the overall population of microbes, known as the microbiota, keep it under control. But if the balance of your microbiota has been damaged, maybe after a routine course of broad-spectrum antibiotics, then C. difficile bacteria can multiply rapidly and produce toxins that make you ill. C. difficile is normally treated with a further course of antibiotics, but because this kills other bacteria in the gut microbiota, a patient will often relapse and become trapped in a cycle of recurrent infections. Eventually, antibiotics will stop working altogether. This can have fatal consequences. Of the 15,000 cases of C. difficile infection that are reported in the UK each year, 1,600 will lead to death. That's why Quadram Institute microbiologists and clinicians at the Norfolk and Norwich University Hospital have come together to deliver an innovative new treatment: fecal microbiota transplants. The transplants involve transferring microbiota from healthy donors into patients with C. difficile infection. The patient receives a whole new, healthier microbiota, leading to immediate benefits. While antibiotic treatment works just 30% of the time, FMT has a 95% success rate in combating recurrent C. difficile and is less than 1/10 of the cost. But this procedure must only be carried out by trained experts. Following NICE guidelines, our team has developed a facility to obtain FMT material, screen it for potentially harmful bacteria, and deliver it safely. In the future, we hope to develop FMT to treat other conditions related to the microbiota, such as ulcerative colitis and diabetes. FMT is just one example of the many novel microbiota-based therapies we're developing in order to bring about innovative change that will benefit society and the economy, and improve healthcare in the UK and beyond. The Quadram Institute is at the heart of the Norwich Research Park, looking at the impact of diet and microbes on healthy aging.
TMF is a treatment that has been shown to be effective in the treatment of recurrent infection by C. difficile, with a cure rate of up to 90%. Prior to TMF, all patients had received at least 2 weeks of treatment with metronidazole or vancomycin. After the procedure, loperamide Modium can be given to reduce the movement of the intestines to retain the mixture during that time.
Spores of Clostridium difficile, or C. diff, can be found in hospitals and nursing homes, where they are often ingested. Taking antibiotics kills the harmful bacteria, but also kills the helpful bacteria that make up the gut flora. Once the C. diff spores enter the body, they survive stomach acid and move into the small intestine, where they multiply. Afterwards, the C. diff moves to the large intestine, causing abdominal pain, bloody stools, and life-threatening colitis, or inflammation of the colon. An experimental treatment called fecal bacteriotherapy is now being used to treat C. difficile. It involves an enema procedure that injects a healthy donor's feces into the patient colon, so that the patient can regain healthy gut flora and clear up the symptoms of C. diff.
Issue applied in Ecuador. The incidence of ICD has been increasing, both on hospitalized patients and in the community. The rate of hospitalization by CD increased approximately to 23% per year between 2000 and 2005, highlighting an increase among people over 65 years, with an incidence 5 times higher compared to people between 45 and 64 years.
Clostridium difficile is a bacteria that often causes infection in people who have had alteration of their gut flora, usually due to antibiotics or hospitalization, and they develop a diarrheal illness which can range from a mild episode of diarrhea to a severe episode which can be life-threatening.
We've seen many people who are just almost incapacitated by it, either because of just persistent diarrhea leading to incontinence and inability to leave the safety of their home for fear of not being able to reach a bathroom quickly enough. It can just wreak havoc with their life. There are trillions of microbes incorporating thousands, if not tens of thousands of different species.
If you take an antibiotic, be it a pill or an IV antibiotic, you may eliminate a lot of those bacteria, similar to destroying a forest. One way to restore that is to take the healthy bacteria that normally live in the colon from a healthy person and reimplant those back into the colon of the sick person. The procedure we talk about as FMT is commonly known as fecal transplantation, but we like to call it fecal microbiota transplantation because the idea is we're actually transplanting bacteria back to their normal residence in the gut. And that can be done by a variety of techniques. It can be done through the upper gastrointestinal tract, through a nasogastric tube. It can be done through an endoscope where it's placed in through the upper GI tract into the lower GI tract, or can be placed in with a colonoscope directly into the colon, or even by enema as long as someone's able to retain the enema. The way we've chosen to do it is by colonoscopic infusion. The reason for that is you can directly visualize the area. You can directly place the bacteria into the terminal ileum and through the colon where it likely belongs. In order to donate the fecal material, we want to make sure that the donors are not going to transmit an infection to the recipient, whether that is even their spouse or a family member. And so the screening that we typically do is similar to what you would do for blood donation, or organ donation. We also screen the donors for Clostridium difficile to ensure that they're not chronic carriers and then are potentially going to provide C. difficile to the recipient.
Once we have obtained that specimen, it goes immediately to our endoscopy technician. We then weigh the stool, determine how many grams of stool, and then we put it in a blender, a common disposable household blender, mix it with some sterile saline, non-bacteriostatic saline, to get the consistency to where we can easily instill it through the colonoscope. We use 60 milliliter syringes. We give you medicine through your IV until you're asleep or nearly asleep. Then we perform the procedure, the colonoscopy. We administer the sedation and analgesia. We insert the colonoscope and advance it into the terminal ileum, the final portion of the small intestine, just before it reaches the colon. Once we're there, that's when we administer typically the entirety of the material.
I think that many people are concerned about putting bacteria into the digestive tract of individuals who are highly immunosuppressed. So bone marrow transplant patients, those that have ulcerative disease in their GI tract, where some of these bacteria could translocate from the gut into the bloodstream. I hate to exaggerate claims, but it really is quite striking. But now there have been numerous studies published that have, again, consistently shown these rates of success of 90% or better.
That's pretty remarkable for this complicated problem.
So I think that this is now becoming a standard therapy.
Conclusion. The TMF in the treatment of recurrent ICD, this strategy should only be indicated after at least 2 episodes of severe recurrence or 3 miles and once other treatments have failed.
That is raising a lot of eyebrows is the notion that we approach something called fecal transplantation. And what that involves is really a way of regenerating the microbiome, of actually pressing the reset button in individuals whose gut bacteria have been compromised. And, this has been a technique that's been used here in America for many years to treat a particular infection called clostridium difficile. Matter of fact, more than 150 hospitals here in America are now using fecal transplant, where the fecal material from a healthy individual is transplanted into an individual who needs to rebuild his microbiome. We are now exploring the broader use of this technique for other issues in which we understand that the gut microbiome has been disturbed. We actually discussed the use of FMT, or fecal microbial transplant, in, for example, the treatment of autism, considering it in the treatment of multiple sclerosis, for example. And clearly this is not mainstream. It is not an FDA-approved treatment. It is not a treatment that I actually do in our clinical practice. But the purpose of BrainMaker is really to explore these ideas, because it really offers a very powerful way of resetting the gut microbiome.
Thank you for your attention.